So, welcome to our very first episode of the Honest Birth Hour. I am here with my friend Dani the Doula, and we are going to do some myth busting with compassion and clarity. This is where we're going to tackle the most pressing questions about pregnancy and labor and birth and help separate myths from evidence-based information. Dani, do you want to introduce yourself?
Hi, I'm Denisha Wallace. I go by Dani, and we're excited to bring our different perspectives together to help pregnant people feel informed and empowered. I'm so excited.
Today, we're talking about your birth team, and that could include any or all of the following people. We're going to talk about what a doula is and what their role is. We'll talk about what the labor and delivery nurse and their role is, what a certified nurse midwife does, and what an OBGYN does, and how we all work together to support birthing people. All right, so I'm going to switch to the next screen here. Our goal here is hopefully to provide something at least weekly and maybe include a health tip of the week and a myth buster of the week, but mostly we're here to answer your questions. So feel free to drop those in the chat and we will get to those in a future episode. All righty, on to you.
So let's start with me. A doula provides continuous support during pregnancy, labor, and postpartum. That includes emotional encouragement, physical comfort measures, and helping people understand their options. We also do things like connecting our clients to resources, supporting family with education and support, postpartum care, whatever that mom and dad or family needs during that perinatal period.
So it's important to recognize that doulas are not your medical providers. They're there for all those other things that Dani just mentioned. Some of the evidence shows that if you have a doula present, you can reduce interventions and you can have a shorter labor and have higher satisfaction with that labor experience. So doulas are definitely an important part of the team. Some of the common myths that we hear about doulas is that they replace a doctor or a midwife, and that's not true because they're not part of your clinical care. They're part of all of those other things that we just mentioned. We work together, and some people think that only wealthy families can have a doula, and that's not true either. Dani, do you want to talk a little bit about that?
Yes, all families deserve a doula, and I'm happy to say that as of 2023, doulas are covered by Medi-Cal and some private pay insurance. Some private insurance. Just look up your insurance and see if they cover doula services. Reach out to a local doula, and there's other doula organizations that can answer your questions in regards to insurance as well.
Awesome. Okay. Let's talk about the path to becoming a doula. So, a doula training is sometimes called a workshop, and it's usually over several days, and it's either in person or online or combined. And then typically there's a number of births that need to be supported. Depending on the program, it can be anywhere from 3 to 10. And then that training and those birth experiences may qualify the doula to have a certification. There are several organizations that do that. And then there may be a program required assessment or exam associated with that. Is there anything you want to add to the path to becoming a doula, Dani?
I think you pretty much covered it. And some programs, I do highly recommend an in-person or hybrid program. I feel like there's comfort measures and things that only you can learn in person. If you do take a online program as a doula to become a doula, um, I highly recommend reaching out to a seasoned doula for mentorship. Or as I have, make friends with a certified nurse midwife.
Okay, and jumping right into that screen, we're going to talk about labor and delivery nurses and what their role is. So, as a labor and delivery nurse, I also am a labor and delivery nurse. You have to be that before you are a certified nurse midwife. And their role is really these four things: assessment and monitoring, clinical care and support, communication and collaboration, advocacy and education. And so, in some of the things that Dani was just talking about, the labor and delivery nurse also does those things, but they have the additional responsibility of being the eyes and the ears of the provider. So whether that be the nurse midwife or the physician caring for you in your labor process and birth process. So they are there to continuously assess maternal and fetal status. They interpret fetal heart rate patterns and recognize signs of complication, and that's where that eyes and ears comes in to play. They also provide physical, emotional, and educational support. They provide administer medications. They communicate any changes that are happening and are there to participate in any emergency response. They are also your advocate. They promote informed decision making, so they support your preferences, and hopefully they are ensuring that you have good evidence-based care. A little bit about the path of becoming a registered nurse. It starts with a high school diploma or GED, and then there's your nursing education, and it will either be an associate degree or a bachelor's degree. So, in that associate degree, they are going to be doing 2 years of prerequisites and general education, and then they'll do 2 years of a nursing program. And in a bachelor's degree, they do 2 years of prerequisites and general education, and then 3 years of a nursing program. They then have to pass the NCLEX exam. And in order to work in a specialty like labor and delivery, they need additional training. So it's usually somewhere between 4 and 6 months of preceptorship where they are, or apprenticeship, where they are learning to be a labor and delivery nurse while working with an experienced labor and delivery nurse. Okay, now what is a nurse midwife? I am a nurse midwife, and this is an advanced practice nurse. So, after my primary nursing degree, I did an additional training to become a nurse midwife. And this is where we specialize in normal or quote low risk pregnancy and birth. That's what we are able to manage without any collaboration. So we provide prenatal care, we attend birth, we prescribe medications, we manage complications within our scope. We also care for the woman throughout her lifespan from basically puberty through the end of her life in women's health um, uh, capacity. So we can prescribe birth control and talk about contraception, and we can treat infection, we can treat menopause and menopause symptoms. So there's lots of things that we do. So one of the myths that we see is that certified nurse midwives are the same as maybe some other midwives you've heard of, either direct entry or licensed. And I'm going to talk about the education in just a minute, and that they're only for low risk pregnancies, which is not true because we also can co-manage with our physician partners when we are moving into that higher risk condition. So a little bit about the pathway is in order to be a certified nurse midwife, you must have your BSN, and then you continue on and get 3 to 4 years of graduate level coursework, depending on whether you're doing a master's degree or a doctorate. And then we have a minimum or a number, depending on your program, of 725 hours of supervised clinical experience. That's us caring for patients in that clinic experience with an experienced midwife. Then we have a board certification, which is a national exam, and then state licensures. We have to maintain both our nursing license and now our midwifery license. And then a direct entry midwife. This would be somebody that typically helps you outside of the hospital. There are no direct entry midwives that work inside of hospitals. So this is going to be what we call community birth. And that is either education with a midwifery program or apprenticeship. And then a licensed midwife is, again, education in a midwifery program and state licensure, which comes from a different place than the certified nurse midwife. It's different in every state. But so these are three different types of midwives. Typically, you will see nurse midwives in all settings, birth centers, home, and hospital, primarily hospital for the most part. And direct entry and licensed midwives will be in the home or in a birth center. Alrighty, do you want to talk a little bit about what an OBGYN is, Dani?
A medical doctor that is specializing in obstetrics and gynecology. Um, OBGYNs manage high-risk pregnancies, complications, and surgical births. They collaborate with certified nurse midwives and doulas for safe birth. Common myths. OBs don't support natural birth. That is not true. I work with many, many, many OBs that support natural birth, and OBs equal interventions only. No, that is not true. I work with a lot of OBs that promote mom or a birthing person letting their bodies do what it can as long as it's safe to do so. And again, we are a care coordination team, doulas, certified nurse midwives, labor and delivery nurses, OBGYNs. We all work together to make sure that that family has a good perinatal experience.
So OBs can handle high-risk pregnancies, complications, surgical birth like cesareans, but they also support physiologic natural birth when it's possible.
Mhm.
So let's look at their education. So again, it starts with high school, and then they have an undergraduate degree, and usually it's a pre-med or science focus, not always, but usually. Then they have medical school, which is 4 years. That includes 1 to 2 years of classroom basic sciences, and then years 3 and 4 are going to be clinical rotations. Then they will attend a residency, which is at least 4 years. Some doctors go on and do fellowships and other things after that. And then they also have a board certification, and it is optional, but most of them do end up doing that. So they have to pass written and oral exams. So you can see that the educational pathways that we've listed here, we're just letting you know what it takes to earn the title of all the different care partners that we see in your delivery. So, talking about our team approach, here's a little breakdown of what we just said. Our doula is non clinical, continuous support and education. Our nurse is clinical, but under the umbrella of working as the eyes and ears of the CNM or the medical provider, the OBGYN, and then you have your OBGYN that is physician led care. But all of these people bring something to your experience. So they are all just as equally important to make sure that you have the experience that you're looking for. Safe, evidence-based, appropriate care that is hopefully along the lines of what you were hoping for.
Mhm.
Let's see. One of our tips here is we always encourage you to ask questions and seek evidence-based information. And that's a little sneak peek into what we're going to be providing you when we come on and do these podcasts. We are going to be bringing you evidence-based information on several topics. So if you have a topic that you're interested in, be sure and drop it in the comments down below, and we will get to it in our next podcast. So tell us what you want to know more about. Is there anything you want to say in at the end here, Dani? Anything that we didn't mention that you want to make sure our viewers know about?
Um, Again, please don't get your information from an unsecured source. Reach out to your local doulas, reach out to your local certified midwives if you are unsure about anything during your pregnancy or postpartum period. Yeah, that's my only tip. There's a lot of false information out there right now, and I highly suggest you reach out to an actual educated provider.
Absolutely. And somebody that is in medicine and not
Hmm.
necessarily just on social media. Okay, well,
Hmm.
it's been great introducing this to you. We're happy that you came to see us. We are going to be bringing you more information, and we'll see you next time.
Bye.